Hello everyone. So today let's talk about the post-hysterectomy wall prolapse. What are the preventive strategies? So for VH we can perform Meckel cultoplasty and during vaginal hysterectomy. So you have to note this point that preventive strategy in vaginal hysterectomy it is Meckel cultoplasty. Though it is more so of MRCOG part 2 questionnaire, but in Viva stations you can add it, okay? And then abdominal hysterectomy and vaginal hysterectomy, in both of the situations we can do the suturing of cardinal and uterosacral ligaments to the vaginal cuff. Yes, that is again a preventive strategy. And then sacrospinous fixation. This is in vaginal hysterectomy. Okay, if I feel that vaginal vault is reaching up to the introitus, then after the vaginal hysterectomy, right, after VH, if vaginal vault is reaching up to the vaginal introitus, then you can perform sacrospinous fixation as a preventive strategy for post-hysterectomy vault prolapse, right? Now coming on to the treatment, which you are going to explain to the patient as well. So in the treatment part, first of all we are going to explain about the pelvic floor exercises, right? So pelvic floor exercises are for stage 1 and 2. They are very effective till 1 and 2 stage. And then the pessary can be given from stage 2 to stage 4, right? And then coming on to the surgical treatment. In the surgical treatment, we have abdominal sacrocolpopexy or laparoscopic sacrocolpopexy, right? So this is what we do in this. For Viva purpose, you should know that we suspend the apical compartment of the vault to the longitudinal ligament of the sacrum. So this will be the apical compartment, means apex of the vault to the longitudinal ligament of sacrum, okay? And then we can use mesh in it or without mesh also. In both ways it can be done, okay? And the good thing will be, in every procedure you need to tell the patient as well as to the examiner what are the positive points which are there. So the positive point is less recurrence, okay, lesser rate of recurrence, and then reduced dyspareunia, reduced pain during sex, and reduced stress urinary incontinence. These three will be the good things, okay, benefits of the procedure, that the recurrence is less dyspareunia. So it is good for this procedure, abdominal sacrocolpopexy. It is good for sexually active women, okay, and reduced rate of stress urinary incontinence post operatively, okay. And now what can be the complications that you need to know? This is bowel complications. There can be constipation, there can be pain during bowel movement, okay, pain during defecation, and then there can be sacral myelitis, pain in the lower back. Then sometimes there can be bleeding, there can be mesh erosion if one has put in mesh. Then there can be mesh erosion in 2 to 10% of the cases, right?